So, let's take a blood pressure or NIBP with the LIFEPAK 15 monitor defibrillator. Select the proper sized cuff for your patient. Put it on the arm nice and snug. The exact position of the cuff is not important because the cuff does not have a bladder. It inflates completely around the extremity. But don't put the cuff on the same arm as an IV infusion because it could affect the IV flow. Also, NIBP will affect SpO2 readings. Connect the tubing to the 15. Push it straight in until you hear a snap. The default inflation pressure is 160 millimeters of mercury, but if you have a pediatric patient or you suspect your patient's blood pressure is higher than 160, you may need to change the default inflation pressure. To change it, use the speed dial to select NIBP. Select initial pressure, then select the pressure you want. Okay, keep your patient's arm in a supported position, relaxed, and at about the same level as their heart. Tell them they'll feel a big squeeze and remind them not to move their arm during the measurement. Now press NIBP, and the 15 automatically inflates the cuff. It usually takes about 40 seconds to complete the measurement. Here's where the systolic, diastolic, and mean arterial pressures are displayed. If ECG or SpO2 is not active, then the 15 will show you the pulse rate from the NIBP here. So now you know how to take an initial BP. What if you need a recurring BP on your patient? Here's how to do it. Select the NIBP area. This time, select interval and choose how many minutes you want between measurements. We'll choose 5. Select Start or press NIBP, and the LIFEPAK 15 will take a pressure at 5-minute intervals. Here are some important considerations. Patient motion can prolong the measurement process and may cause discomfort. Be sure the patient's arm is relaxed and that the cuff is not bumping against other objects. Patient arrhythmias can prolong the NIBP measurement time. If the monitor is unable to obtain a reading in 120 seconds, then it automatically deflates the cuff. If the cuff fails to deflate for any reason, or if it causes the patient undue discomfort, disconnect it from the tubing or remove the cuff from the patient. If you find it routinely takes a long time to inflate the cuff, there may be an air leak in the system. Check the cuff and the connections. There are messages built into the NIBP monitor to help troubleshoot problems. Refer to the troubleshooting tips in the operating instructions for the messages and corrective actions. Remember, NIBP is a tool to be used in addition to patient assessment.